So when you're suffering with chronic pain, you have to give up a lot of things in your life. Maybe you can't play basketball with your friends anymore. Maybe you can't play it with your kids. And even a pop-a-shot ball like this is a little bit too much for you if you go to an arcade. So that's what we're going to talk about today is pain with Dr. Kousaie. How are you?
I'm very good, and how are you?
Eventually I should probably get rid of this prop because I'll just play with it for this whole show. But,
play.
You know.
Have fun.
Yeah, we just did one on gambling because the Cavs lost last night, so I thought it was the appropriate discussion. And I lost $30 live on air. Yeah, taught me not to gamble anymore. So there we go. But why don't we talk about you first? Usually I go right into all the things that your practice does, but you're an anesthesiologist, which I've been trying for years on the show to get another anesthesia person on here so we could talk anesthesia stuff, much to probably the boredom of anyone else watching. But
right.
So what's your history? I know you've worked at Summa, Crystal Clinic, a lot of those places.
Well, I'll start at the very beginning.
Yeah, tell us about yourself.
I was born and raised in beautiful Kent, Ohio, just down the road. Haven't traveled very far from home. And it's great to be with the CRNA,
Yeah, absolutely.
So we're the team.
I
decided to go to medical school and went to medical school in Creighton in Omaha, Nebraska. Mm-hmm. Then went to the Cleveland Clinic and University Hospital for my training. And I trained and became an anesthesiologist, and I did, at the time, 6 months of pain management, which is what they did back in the 80s. Mm-hmm. That's all they did. They didn't do the big pain fellowship.
Right.
And
we're still talking about 13 years worth of education, basically.
Oh, yeah.
Yeah.
Medical school, residency, and all the training.
Right.
And then I started setting up practices, first in Portage County and then in Summit County. Yeah. I've worked at Robinson, which is now University Hospital.
Yep, my first anesthesia clinical back when it was Robinson.
Mm-hmm. When it was Robinson Memorial. Mm-hmm. The last county hospital in Ohio.
That's right.
And then built a surgery center in Kent, which was known as Western Reserve Surgery Center, mm-hmm. with 14 surgeons and our anesthesia group, and carried on the pain tradition there. Then came here to Wadsworth for a stint for about 4 years, did anesthesia and pain here, then went to the Crystal Clinic, and then Summa.
Wow. And for those of you who don't know what we do in the secretive halls of the operating room, it is more than just, okay, let's keep you alive during surgery, because we're seeing patients beforehand, finding out what their history is, figuring out a plan that will meet their pain needs both during surgery and in the immediate post-operative care unit. So in anesthesia, we are uniquely situated because we have to focus so carefully on exactly what's going on with the patient. So,
right. We do a lot of blocks,
mm-hmm.
injections with local anesthetic to try to prolong the effect after surgery. So if you're working on your arm, you'd numb your whole arm, maybe for 24 hours. And that's usually the worst part of the pain, which
Yeah.
For worst part of the pain is 24 hours.
Absolutely.
And it exponentially decreases.
Mm-hmm. And it made my job easier too. In my early days of being a nurse anesthetist, we would do a knee surgery without any blocks. So I would maybe have 500 micrograms of fentanyl, 2 milligrams of Dilaudid, trying to mix in all these agents, and it'll be successful. It's a lot easier now with mm-hmm. regional anesthesia, where you can simply block the pain rather than trying to mask it.
Right.
And that's kind of why you're here today, because I feel that as a culture in healthcare, we've been trying to mask pain instead of block it for the last several decades.
Right.
Do you like that segue? I'm proud of
that.
That
was
right
very,
there.
very good.
Yeah.
I like that. Yeah, basically, originally it was the biggest part of a pain clinic was giving opioids. Mm-hmm. And then you would do your, quote, blocks, epidurals, both cervical and lumbar. You'd do facets, radiofrequency, SI joints. Of course, once again, all temporary.
Right.
Okay. Now, with the opioid crisis, people are moving away from the round-the-clock opioids, which there's a lot of problems
mm-hmm.
with.
Absolutely.
Okay.
Yeah, along with steroids, opioids are the most dangerous drug class. So.
Absolutely.
And I'm sure that stimulants and benzodiazepines are like right underneath them. But
yeah, and
it's probably another show.
Right. We could do that show. That'd be
fun.
fun.
Now we got time.
Yeah. Okay. Anyway, so for years, what I was tasked with was bridging the gap between the people with chronic pain and some type of pain reduction with minimalistic opioids. Mm-hmm. Because a lot of the places where I worked, and they wanted minimal opioids.
Right.
And they didn't want the in and out of the OR every 6 months for radiofrequency ablations for SI joints, because a lot of them were orthopedists, and they knew the dangers of constant steroid injections.
Right. Yeah. Which is really cutting edge, because a lot of times we'll see health systems that are short-sighted, that, well, insurance pays for this, yeah, let's do it as long as we can ride this train, so to speak.
Right.
So, and you're right, that as you continue to do these interventions, the actual quality of both the person's health, when it's time to do that operation, they may not be healthy enough to survive a surgery, for one
Correct.
thing. Plus the steroids destroying the bones and the tissues not working well. And
Right.
it's like,
Cortisol
basically,
load.
this is probably a terrible analogy, but sort of like, okay, here's your Lego set, but the dog chewed up everything. Good luck building anything with it.
Right.
And I mean, that's how orthopedic surgeons think. It is basically shop class. So
Yeah. Carpenters.
yeah. So that does
Very good carpenters.
Absolutely, yes. Very, very
But
expensive.
they'll be
Legos
the
as
first
well.
to tell you, hey, look, I put it together, and then they'd hand it to, you know, if you were in my clinic, it'd be you and me.
Mm-hmm.
And then you and I would sit there, look at the patient, and say, what do we do now?
Right.
And, you know, there's no long-acting blocks.
Absolutely.
In fact, in 1980, I think it was probably 86, when I was an impressionable resident, the government banned a substance called LALA, L-A-L-A, long-acting local anesthetic.
Mm-hmm.
And it would literally do a competitive block on the nerves that would stop the nerves from transmitting for 2 weeks. Well, you know
Wow.
what was happening? People were coming in, their incisions were dehisced, they had burned themselves, they had broken a finger and didn't know it because the block had lasted that long.
Wow.
So it was gone.
I never knew that. That's really fascinating.
Yeah, Layla. I remember one of the the docs talking about it.
Mm-hmm.
Oh, this would be a great thing. This would be a great thing if it didn't do this.
Right. No, that makes a lot of sense. And that does explain again how you've gone from anesthesia to pain management, the relationship of, okay, yeah, you're fine for the surgery, but we need to think long term of how can we get you feeling better for weeks. I mean, at Ascend, it's similar, where for me it was a slight adjustment at first. Instead of how can I make you pain-free for a day, with the ketamine infusions of how can we get you pain-free for months, perhaps permanently. And again, everyone's different.
Right.
So we try not to advertise, you know, we can cure your pain.
Right.
But sometimes it is a combination of how can we reduce this inflammation to the point that your nerves find different pathways around the pain,
Right.
instead of just continually going in this cycle.
Right.
Which is a lot like the gambling show we just did before you got here, of like there is this cycle that happens in the brain that's very hard to break.
Right.
And it does take a very holistic way to find ways around that pain. So,
Exactly.
And originally they thought, well, we'll just give you pills and that'll break it. But as you said, it just masks the problem. The person's health deteriorates.
Right. Well, problem with opioids, you know, there's depression, there's loss of sleep. It decreases your hormones.
Mm-hmm.
Okay, so there you are, you're in your 40s, 50s, as a male, and your testosterone goes down, and you're like, God, why do I have low T?
Right.
Well, part of the reason is the opioids are taken.
Mm-hmm.
Women get low progesterone, low estrogen, and they also have some testosterone. They get low testosterone, and then there's all the mood changes.
Right.
Absolutely. And the less you move, the less you're able to move. So, like
and
you
the less
say,
you want
it's
to
a
move.
cycle.
So yeah, absolutely. Which doesn't always sound intuitive to people, that, oh wait, this is about hormones. But again, the human body is so complex that once you push one thing, and you can even replace all those hormones. You could bring someone, know every single problem, know all their labs, replace everything synthetically, and yet you have an unhealthy, unhappy person in front of you. So even if you have all their genetic information, I used to do a lot with functional medicine, 23andMe, that sort of thing. You can replace all the enzymes that are missing, but that doesn't necessarily mean that you'll get the full picture back.
Right.
So why don't you tell me a little bit about what you do at your current practice now?
Okay, well, for years, since the late 90s, early 2000s, I have searched all over for complementary medicine, okay, that helps decrease pain, that has very few side effects, and works reasonably well. And the beauty is they've come up with some very nice things, okay? Acupuncture, probably the first one, all right? It's been around for 5,000 years.
Right.
And wherever you want to say it originated. Some people say it originated in the northern China up into the steppes of Russia and into Europe because they found Kousaie the Iceman frozen in the Alps. And when they did the necropsy on him, they looked and he had tattoos. And one of the doctors doing it goes, oh, by the way, those are acupuncture points. And sure enough, when they looked in his pouch and stuff that was perfectly preserved in the ice, he had needles. If he had a knee pain, he knew where to do.
Wow.
So acupuncture is very nice, very safe, works well, increases some stem cells, decreases your pain.
And just a few weeks ago, there was a study where they showed there was this interstitium right below the skin that almost works as like a secondary lymph system that was never,
Right.
and they're like, oh, this might be why acupuncture works.
Right. That's where the chi is.
Right.
Which is the life. And then for years I've used both a laser and electroanalgesia. Now it's being called pulsed electromagnetic frequencies. But what does this stuff do? Well, the big thing was in the 50s and 60s in Russia, because they were trying to put people in space and they're trying to build a huge nuclear arsenal with less than 100 and some million people in a vast area. The rural hospitals got nothing. So
Right.
they put a lot of work into electric medicine, which we could go into, by the way, started in Greece with the seashore treatment, where they put an electric eel in one pool and you'd stand and ground your foot on the other sand.
Us Greeks were so innovative.
Yeah, and the electricity would go up and through you, and it would decrease your radicular pain, your neuropathic type pain. So they knew that. So the Russians then kind of perfected this electroanalgesia. And there's multiple units out there, and it works well. And what does it do? Well, it decreases your pain, it stabilizes the nerve's membrane, it increases stem cells, increases blood flow to the area, thus decreasing inflammation.
So by stabilizing the nerve membrane, it's just less likely to fire pain signals?
So if you think about why people get gabapentin now, the docs are, gabapentin's huge. Oh, you got pain, yeah, we're going to give you gabapentin.
This can be the nerve ending if you want a little.
Okay,
Yeah.
so
We got to use this basketball as much as we can.
okay. So anyway, here's your nerve ending in your spinal cord, and it's getting bombarded. Pain, 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 pain. So you give gabapentin. Why? Gabapentin's an anti-seizure medicine. It works in the brain to say no seizure instead of seize. So now the nerves going in the spinal cord going up into the brain, instead of pain, 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 you get pain, pain, pain. So it decreases it. All right? Doesn't work for all kinds of pains. Great in canines, by the way. For some reasons, your dog takes gabapentin.
He's great.
He's great.
Yeah, ours swallowed the rock. He had gabapentin for a couple of days. He was great.
Good to go.
Yeah,
Okay.
$7,000, but that's a separate show.
Yeah. Okay. We can do that one too.
Absolutely.
Yeah. My dachshunds do the same thing.
Yeah.
Yeah. They eat everything.
Yeah, get your head in the game, Peanut. Quit eating them rocks, okay?
Right. Come on. So anyway, what it does is it does the same thing. It stabilizes the nerve membranes. It increases stem cells, and that's what regenerative medicine is all about. So you're doing this electroanalgesia on people, and it's cheaper than a block. So if you did all 10 or 15 treatments over several weeks, it's the same as one time in the OR for either an epidural or whatever. And it works well, okay? And it's something that can be repeated. People who are on anticoagulants can use it.
Yeah.
The nice thing is, unless you put it directly over the pacemaker or directly over the carotid sinus, you're not really going to hurt anybody.
Right. And that is so important because, again, depression, this is true too with the side effects of psychiatric meds. I mean, one of the reasons that Ascend Health Center exists. But for pain, there's so many ways to treat pain that themselves can cause a lot of pain or can cause a lot of side effects. And then not only are you out on your money, but you are also in worse case than you were before. So you're saying that with this, let's say it doesn't work, well, like you're in no worse shape than you were before you started.
Right. Insurance pays for it, and you're right. You're not in any. I've never seen
I'm a bit of a
anybody
pessimist.
being
I always
total failure. But yeah, not everybody responds 100%. Well, not everybody responds 100% to anything.
Right.
you know, gallbladder surgery, whatever. All the stuff we see all the time. You get your knee replacements and you're never as good. Or you get your shoulder replacement and you say, gosh, I can't play golf.
Right.
You know, I just don't have the mobility. Yeah, and so that's just it. You're never as good as you were before. So I like electroanalgesia. It works, and like you say, it's safe. You know, there's no side effects. I mean, I could tear open a wound, you know, if used. You could get a little suction cup bruise. Looks like you got attacked by an octopus.
Right.
But if you're on a anticoagulant, you can use pads that don't use the suction. So,
and again, for the science part of it, it sounds like it does both. So again, our nerve ending. Ketamine is more of almost the opposite of gabapentin, where you suddenly have all this synaptogenesis around the nerve, that there's pathways around the pain.
Right.
Neurontin or gabapentin is sort of the opposite, where you're just not getting as much stimulation. You're saying it has lesser stimulation like gabapentin, but by growing stem cells, you're also creating new neurons so they can find another pathway, basically.
Right.
Great.
You know, new neurons, more blood supply to the area, more blood flow, decrease the inflammation. So it's very good.
Yeah, because I feel that a lot of people for pain, there is like a weakest link. And so when you bring the body's resources to that weakest link, then a lot of times the body can start the healing process itself. And again, the whole goal, I think, for both of our practices is let's set you up so your body can heal yourself, as opposed to being completely dependent on us.
Right.
So I think our days of being heroes are behind us, and now we'll just
absolutely. Now the whole thing, like we've been talking about, what is that? That's regenerative medicine.
Absolutely.
And you know
and not the fad part of it either, like the concrete, here's your results, avoid the TikTok video, just come to us.
Right.
And that's the thing too, like some of the stuff that we do isn't covered by insurance, but if it was, you're still looking at a huge copay because of all the training that you've done, because of the way that insurance reimburses anesthesia. So I think for patients, this is a best case scenario where you get that expertise without quite the price tag, honestly.
Right, exactly. And we keep it low, and we also use care credit. So you come in, you say, hey, dude, I want to put this on, I'm going to put it on a credit card, but I want care credit. Yeah, we can get you set up.
Awesome.
So that's why. So we're entering into, like you say, the new era of regenerative type medicine.
Right.
Okay? And if you see these people running to get stem cells.
Right.
And stem cells do work,
I had a chiropractor on here, I think, a year or two ago, and we talked all about a lot of those therapies.
Yeah. And it works. But for the $15,000 to $20,000, tag, I guess now it's down to $5,000. I've seen knee injections, stem cells now for $5,000. So, but still, that's a lot of cash.
Right.
And it is cash, and the government's not paying it. So, but you can also get stem cells by doing electroanalgesia. The laser does the same thing. Okay, the laser now is a photon beam thing. So you come to me and you say, dude, my knee's killing me. Okay, it's inflamed. Laser does the same thing. Laser gets in there, it stabilizes membranes, it decreases inflammation, and it eventually has a neogenesis of blood vessels. And that gets in, like you say, tells the nerves to calm down, decreases the inflammation, and helps. Okay.
So is that a cold laser that you use?
Yeah, well, actually mine is...
Sorry that this is so nerdy for everyone watching.
Right in, mine's kind of right in the middle.
Okay.
Okay, so it does have warmth to it. It's a class 3B. So there's two different types of light. There's the red light therapy that comes out of a LED, and that, great, it'll get rid of the wrinkles in your face, and it goes down about a centimeter into your skin for collagen. And the warmth, that one of the wavelengths, you're actually technically supposed to have a 960 wavelength, 960, but most of the ones you can buy, and including the medical, do 660 and 840 or 820, and it's great. But the laser being made in an actual tube, and you know how it bounces, it excites the electrons, they shoot off a photon that goes out down a cable, and then you get photon beam that'll go 6 inches into your body. Okay, again, safe for every place but the eyeball. Okay,
Right.
Has a little bit of problem, it won't go through the dentin in your teeth.
Okay.
It will penetrate your skull and go down a little bit. If you wanted for some reason to use it on your brain. But scalp injuries, shoulders, knees, and it's safe everywhere except for the eyes.
Okay.
And the only reason it's not safe for the eyes is you take this tiny little pinpoint of light and you send it through a lens, and that lens spreads it out. Well, think of what your eye does. It has a lens that does exactly the opposite. It takes all this light, cones it down, so you could technically burn out your retina.
Does it help with migraines at all? Since
It will.
Okay.
Okay.
That's always been a challenge.
And
we treat it with
you put it
ketamine.
on. Okay. You can use it on the face, and it will work. I actually think that acupuncture works a little bit better for that.
Yeah.
But that's good. So, you know, the laser's a great thing. Boy, back pain. I without violating HIPAA, I had a guy 5 years ago, and he says he was having this back problem, and they were saying chop, 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 and he goes, no. And I said, well, let me do the laser on you. And I did the laser. I did actually 6 treatments, and he never came back. I see him every now and then. How are you? He goes, I'm 100%.
Right.
Of course, he did extra. It's not just a laser. You know, I'm not going to fool anybody. You know, he did physical therapy.
Right.
You know, he took some anti-inflammatories, and you know, he did very well.
Yeah, it's that combination, and I think that is something unique about the two of us. Is that, you know, often I will tell patients, like, no, it is surgery time, but because we've been in surgery so much in anesthesia, we can sort of like, okay, here's 1 or 2 things you can try before we go to that. And especially since we deal with a lot of mental health at Ascend, it is so that they can go into surgery knowing, no, I've done all the steps in the right manner, and now it's surgery time. So that you can sort of be okay with that decision. So,
Exactly.
have we covered everything, or what else do y'all do there?
Just the last one is the one I'm very excited about. It's new. It's stem wave.
Okay.
And you remember shockwave because you were in the OR when the people were getting their kidneys blasted.
Yep. Lithotripsy.
Lithotripsy to knock the stones. Well, interestingly enough,
Great way to go.
Yeah.
If I had a kidney stone, that's what I want.
Oh yeah. Instead of reaching up with a basket and trying to pull it out.
Yeah, just use some ultrasound on me, I'll be fine.
Exactly. So anyway, I'm very excited about the stem wave because the stem wave does everything that all the other ones do, only probably is a little bit better. So what it does is it actually shocks, there's a spark plug and a bag of water, and then it gets transmitted into your body. Okay, and what does that do? So now your cells go, and they say, oh my God, I'm injured. So they secrete all these factors out into the periphery that say, we're injured, do something. And then all of a sudden the cell wakes up, looks around and goes, hey, we're really not injured. But all the factors are already out. So now you have cells turning into stem cells. Why it's called stem wave.
Right.
Goes in and it helps you heal. Again, stem cells, decrease inflammation, increase neovascularization. It makes new blood vessels grow. By the way, this is the technology that you're hearing about. The guys are going to their urologist and getting zapped, so new blood vessels will grow in their third or second brain, so that it will stand up. It's for ED. But anyway, it's really good. Now, the interesting thing for me, and because I'm on top of this, is for the NIL athletes. So your name, image, licensed athletes. So you get an injury, you come to me and say, Frank, I can't play basketball right now, or my son can't play basketball.
And I don't want to resort to pop-a shot.
Right. So there is evidence in the literature that says if you do the stem wave, they return to function 50% faster, and 50% their pain goes away 50% faster, and they're back in the game.
Absolutely.
So you got your son hurts his shoulder throwing a football, and he wants to get back in the game. Stem wave. Can't do it over the lungs though, because obviously that you're cavitating the lungs. But it's just a really, really good. It's a way to go.
And the best part about all this, for those watching, is that your practice is right down the street. So Akron Neurology used to be across the street, and we would literally walk patients over, introduce them to Dr. Friedman, and say, okay, here's the next step. So it does allow for a very warm handoff between the two of us, which I'm really excited about.
Very good. It's going to be great.
Yeah, absolutely. So the Fairlawn Copley area, I mean, got any issues, that's where you want to be.
Yeah. I think we're really gonna help people.
Absolutely. This is great. Do you have anything else coming up, or anything else you want to talk about in the minute or so that we have left?
I'm pretty much said everything. You know, I'm still in a traditional medical practice. I mean, you'll have to come in and get a history and physical.
Yeah,
you don't just
absolutely.
walk in the door and say, I want this treatment, exactly like what you do.
Yeah.
You're not
It's
just
not
saying
boutique. We've
not
got
a
a couple
boutique.
options, and we'll help you decide which one's the best one.
Right. And then, you know, so I'll bill your insurance, and then you'll get the chance to go ahead and go out, and here's the literature. Read. This is what I think you should do, but I get people that say I'd rather do this. And that's fine.
Yeah.
So we do a tradition. It's a medical practice.
Right.
I'd like to get bigger. I'd like to, you know, do all kinds of things, you know, get, you know, people in there that'll help. But, you know, we got to start out small.
We do. Yeah, that's what we realized with Ascend as well, that we have a lot of powerful technologies here, the TMS, the ketamine, the Spravato. But at the same time, these things work better if it is organic, and if we, you know, guide patients like, oh, you know, this is actually the better option for you, or let's try this. So,
well, I'm excited about being with you because one of the things that in traditional pain medicine that's overlooked a lot is the brain.
absolutely.
Okay, is the brain.
We barely do pain ketamine infusions like the 4-hour ones anymore. Just over the years, we've realized, no, if you just shift a few things in the brain, the pain will go away. So,
well, there's a couple of books out there, and I know you've read them. You know, Less Pain, Less Pills, or Less Pills, Less Pain. You know, it talks about exactly what you do.
Yeah.
It talks about, you know, you got to tell the brain that it's safe, because
Right.
pain is telling the brain it's not safe.
yeah. And until it feels safe, you know, it might start out as PTSD, but you don't treat it, and it will become the fibromyalgia, the multiple chemical sensitivities, the EDS, the POTS, all these things that we see as consequences of sometimes even just one event. Like
Right.
all of a sudden, the entire immune system, all the pain receptors just shift.
Right.
So, and that's basically what we're both trying to do, is shift them back to where they need to be.
That
So,
neuroplasticity is no good.
absolutely. Well, thanks for coming to the show today.
Thank you so much for having me. I appreciate it.
Absolutely.
You are watching WCTV, Wadsworth Community Television.